Hi, everyone. I'm Gretchyn Bailey, and I am a fellow of the Academy. I am joined today by Anna Bedwell, who is also a fellow of the Academy, a fellow of the Optometric Retina Society, and clinical associate professor and director of residencies at Indiana University School of Optometry in Bloomington, Indiana. Hi, Anna.
Hi, Gretchen. How are you?
I am great, and I'm thankful that you're able to join me today to talk about this interesting paper.
Yes.
This is real-world treatment outcomes after delayed intravitreal therapy in center-involving diabetic macular edema, the RETORT study. And this was conducted by Chituri and colleagues in the March 2023 issue of International Journal of Retina and Vitreous. This single-center retrospective interventional comparative study looked to compare real-life data on delayed intravitreal treatment of diabetic macular edema patients to early treatment. So, Anna, can you tell me how delayed were the treatments to that group of patients examined in this study?
This study in particular was looking at those that had moderate visual acuity loss, so specifically worse than 20/30. We already have a lot of good information about those that have a center-involved diabetic macular edema with very good visual acuity that came out of the Protocol V study. So this looked at a different group that more had moderate loss.
So what did the study results show?
So this study had two different groups. One that elected to have treatment early on, and by early on, that was within 24 weeks of the retina specialist advising treatment. The other group was delayed, so greater than 24 weeks, whether it be they delayed treatment because they refused or declined or were lost to follow-up. So the second group is a little bit smaller in comparison. And basically, both groups, once treatment was elected, had treatment directed by the retinal specialist, whether it was anti-VEGF injection, a steroid treatment. And what they found is those that had the delayed treatment, which on average was about 31 weeks before they had treatment, they did poorer than the group one who elected to have treatment. The first group gained visual acuity, gained more ETDRS letters, while that second group who delayed ended up, even with their treatment, declining in vision and losing letters.
What do these results mean for the treatment of DME moving forward?
Well, it really doesn't change our protocol in the sense that we would still advise treatment to this group, but it's going to change how we view our education. In that when we're discussing those that have visual acuity loss, worse than 20/30, explaining why to patients there's a necessity to have that treatment, is that we run that risk potentially of worsening vision. We understand that with chronic diabetic macular edema, you can suffer long-term damage. We see that in the outer retina on OCT, seeing changes in the external limiting membrane, in the ellipsoid zone, and RPE. So in that second group where you've delayed treatment, you just run the risk that retina sustains permanent damage that can't be reversed with treatment.
Right. Well, thinking of optometry then, why does this study matter to ODs?
It matters in the sense of we're the ones educating and referring those patients. So when patients are not sure, we have we're the first voice they hear to explain why they need to have that treatment.
Got it. Well, Anna, thank you so very much for taking the time today to talk with me about this study.
You're welcome.